Okay, so for the start of your day, first thing you're going to do is you're going to come in, you're going to turn all these switches on over here. You're going to make sure they're running. Then you're going to get some gloves. You're going to fill the ultrasonic. Here, one tablet goes in. You're going to grab an ultrasonic tablet right out of the clinical efficiency bin. You're going to open it. You're going to drop it in. You're going to fill it up. Top, put the lid back on, alright. Change your gloves. We're going to come into the room that you're going to be working out of. First thing you're going to do is you're going to drop the chair in the room. You're going to turn the TV on. Make sure the TV is on. You're going to get your computer started. You'll come over here. Make sure you turn on your humidifier, full, whole way on, okay? Then patient napkins, we put patient napkins on the counter. You're going to do a cup. Cup's going to get half peroxide, half water, so that when you have your patient ready, the patient's going to rinse out for a full minute. Time them, a full minute is ideal. Then we're going to go in, we're going to get our tray set up. Procedure we're going to do first is we're going to do a crown prep. So we're going to come in here. These are our clinical efficiency sheets. These are holy. On here you have every single thing that you're going to need. So basically anybody can set up a tray and get started. So I'm just going to grab my tray. We're going to get our bib, our tray cover, a basic setup here. Always. I'm going to go with some cotton rolls on it, some 2x2s, slide ejector, Iso-Dry. Then we're going to come over here, and then if you read off your sheet, it's going to tell you everything that you're going to need on here. So I'm going to need one of these yellow tips with one of the little yellow tips. I'm going to need 2 of the teal. In this case, I'm actually going to need 4 of the teal and probably 2 of the yellow, just because we're going to be doing both sides. I'm going to need 2 temporary tips here. I'm going to need a crown remover, a crown separator. Always is good to have in your tray, whether you're going to do it or not. And I'm going to need 4 of the posterior trays. Always do 2 of the short and 2 of the long. And then usually our heavy body and our impression material is always into the room, so you'll be able to pull from there. Then you're going to grab your syringe, the type of Novocaine you're going to need, a short or a long needle if necessary. Always an Iso-Dry system. So we're going to be working on the upper, so we're going to use a medium, and the reason we're going to use a medium is because the DV is meant for the lower, to protect the tongue, the cheek, and all of that, push everything away. We're going to come into the room. We're going to set our clinical efficiency sheet here, and on the sheet we're going to put the patient's name. The type of disc profile just basically means the type of personality the patient has. Patient notes, like a fun fact about the patient, family member, anything they like to do. And then the treatment being done with your initials. The doctor does require that you check off every single little check mark here for everything that is in the room, so that when he comes in, he doesn't have to worry about not having whatever it may be that he needs. So I'm going to start setting up here. I'm going to put all my syringe, and I'm going to grab a cup for the sharps. This is very important to have a cup next to the syringe, just so the doctor can put anything that has already been used into the cup. All of your tips and all of your trays are going to go on your side, assistant side, so that you are ready to go for the doctor. Bring all that over here. Nice and neat, kind of, if you can. And then open all this up. We're going to put all this on this side. And then when the patient comes into the room and we have them seated, I will show you how to do the finger test for the Iso-Dry system. I'm going to grab one more thing. Then we're going to lay the lab slip on the counter over here. Typically, I would, suggest having partially of the lab slip filled out, so the doctor just has to sign it. Then you're gonna have 2 sandwich baggies here with both patients' name on it, for one for the final impression and one for the preliminary impression. You will copy the lab slip. Alright, so basically I'm just going to go over the room setup, how you're expected to set up the room, and what's kind of expected of you. So we're going to go back over the clinical efficiency sheet here. We're going to go over everything. We're going to do a check mark, hand pieces in the room, syringes loaded, cup for the sharps, topicals out. We have the IsoDry system over here. We have our basic setup that is going to be on the tray over there. Also have white paper here for the doctor. Camera sleeve is on. Flowable with a tip we have over here. Some cotton rolls are on the tray, saliva ejector, barriers. The barriers are this. We expect those to be in all of the rooms. Trays, whatever is necessarily needed. This is going to be a posterior tooth, so we're going to use one of these. I have a longer and a shorter tray just in case the doctor requests a longer one. I don't have to step out of the room. I have heavy body, light body, temp material, the shade guide, all the tips that are needed, temporary material, impression material, all that is over here with your lab slip, your shade guide, your baggies for your patients. Temporary tips I put on this side just so I have it ready for me. In this case, the chart would be up with the x-ray on the screen over here. In this case, we, step back, we can do that again. So just make sure you check it all off. You have everything ready to go. Burr block here with all the type of burrs you're going to need. You're going to need a longer one, a shorter one. Like an acorn is what we call that. We call this technically a football, and these are 2 polishing burrs that the doctor likes to have out. Also, something that's duly noted is we want to make sure that we test all of our hand pieces. So what you're going to do is you're going to put a burr into the hand piece, you're going to step on the foot pedal, and you're going to run it for at least 30 seconds. Make sure that is good. And so just going to make sure I check everything off. After I have everything set up and ready to go, I will get a little sticky note here that we have into our drawers. Every room has one. Let's just start this one over, and then we will put the patient's name at the top, what room they will be in, if it's an existing or a new patient, what is being done, so we put crown number 2, and the specific doctor will be Dr. Simone, and then who does it, I put my initials at the bottom, and how soon I need him to come into the room. So I would need him into the room by 10:50. And then what I would do is I will take this to the doctor and get it ready.